Good afternoon, good evening. You are humbly welcome to Jogolis Entertainment. Will give you hot gist of all the trending activities happening globally. Today, we'll be focusing more on health. Health, they say, is wealth. A healthy man is definitely a wealthy man. Well, today, let's talk about cesarean section. There's this question that has been bothering people, and today we'll be answering the question. We'll be discussing when it is safe for couples to resume sex after a cesarean delivery. Before we dive into the topic properly, let's know what cesarean section or cesarean delivery means. A cesarean section, also called a C-section, is a surgical procedure performed when a vaginal delivery is not possible or safe, or when the health of the mother or the baby is at risk. During this procedure, the baby is delivered through surgical incisions made in the abdomen and the uterus. Have been asking, or pregnant ladies have been asking themselves is, when would I need a cesarean section? A cesarean delivery might be planned in advance if a medical reason calls for it, or it might be unplanned and take place during your labor if certain problems arise. You might need to have a planned cesarean delivery if any of the following conditions exist. Cephalopelvic disproportion, or CPV. CPV is a term that means that the baby's head or body is too large to pass safely through the mother's pelvis, or the mother's pelvis is too small to deliver a normal-sized baby. 2. Previous cesarean births. Although it is possible to have a vaginal birth after a previous cesarean, it is not an option for all women. Factors that can affect whether a cesarean is needed include the type of uterine incision used in the previous cesarean and the risk of uterine rupture. 3. Multiple pregnancy. Although twins can often be delivered vaginally, 2 or more babies might require a cesarean delivery. 4. Placenta previa. In this condition, the placenta is attached too low and blocks the baby's exit through the cervix. 5. Transverse lie. The baby is in a horizontal or sideways position in the uterus. In this condition, a cesarean delivery is always used. Breech presentation. In a breech presentation, a breech birth, the baby is positioned to deliver feet or bottom first. If your doctor determines that the baby cannot be turned through abdominal manipulation, you will need to have a cesarean delivery. An unplanned cesarean delivery might be needed if any of the following conditions arise during your labor. 1. Failure of labor to progress. In this condition, the cervix begins to dilate and stops before the woman is fully dilated, or the baby stops moving down the birth canal. Cord compression. The umbilical cord is looped around the baby's neck or body, or cord between the baby's head and the mother's pelvis. Prolapse cord. The umbilical cord comes out of the cervix before the baby does. Abruption placenta. The placenta separates from the wall of the uterus before the baby. Fetal distress. During labor, the baby might begin to develop problems that cause an irregular heart rate. The doctor might decide that the baby can no longer tolerate labor and that a cesarean delivery is necessary. So we've seen reasons why some mothers need to go through this process called cesarean section to deliver their babies safely. Now, another question is, how long does the cesarean section procedure take? The typical C-section takes about 45 minutes. After the baby is delivered, your healthcare provider will stitch up the uterus and close the incision. There are different types of emergency situations that can arise during a delivery. In some cases, the cesarean delivery will happen very quickly, with the baby being delivered in as little as 15 to 20 minutes. This is an emergency C-section. Afterwards, there will be additional time when the provider will stitch up the uterus and abdomen. The source of this information is my Cleveland Clinic points. The major points why we are discussing this, why we are going to see session, is when it is safe for couples to resume sex after a cesarean delivery. That question has been troubling so many couples out there, because most of them don't know the right time to resume sex after a cesarean delivery. Well, as I said earlier, Cesarean section, CS, also called cesarean delivery, is one of the challenging areas for some married women in marriage due to the pains associated with it during childbirth. CS is a birth method that requires the tearing of the abdomen and uterus of a pregnant woman during child delivery through surgery. Most times, it is recommended for pregnant women when vaginal childbirth will endanger the life of the mother, unborn child, or both. However, irrespective of the method of childbirth employed, it does not change the lovemaking urge of the man and or lady, in as much as CS won't stop married couples from desiring each other for lovemaking. According to a medical report, there is need for husband and wife to make love at the right time after cesarean delivery to avoid occurrence of complications in the process. Available information provided by medical experts recommend that lovemaking after CS should occur between couples based on the following factors. 1. Complete closure of the cervix. Even though a woman may not have given birth to a child through vaginal delivery, she will still experience some bleeding. For safe intimacy to happen, the bleeding needs to stop, and her cervix should also completely close before resuming lovemaking. The report revealed that it takes up to 6 weeks for the cervix to totally close. Permission of an obstetrician. Regardless of the 6 weeks estimated time for the complete closure of the cervix after CS, there is still need for a nursing mother to consult an obstetrician for examination during her postpartum period before married couples can comfortably make love without any fear of experiencing complications. This is important because of variation that exists from one woman to another, as well as what led to the occurrence of the cesarean delivery. In addition to the aforementioned, medical experts also unravel that because intimacy is more mental than physical, the woman's readiness after having a CS should also be put into consideration so as to have a pleasurable and fulfilling lovemaking experience. Note: when making love after cesarean delivery, certain intimacy positions that can stress the abdomen and make the woman vulnerable to pains should be avoided. Do you find this content useful? If yes, please don't forget to hit the subscribe button, the notification icon, so as to be updated whenever I upload new content, and feel free to share this video on any of your social media platforms. And the source of this information is Helpline. Thank you very much for watching Journalist Entertainment. We hope you entertain. Please make sure you hit the subscribe button. Take care of you and do have a lovely day.